All right, in this chapter, we're going to look at exercise and its effects on individuals with immunologic and hematologic disorders. So in looking at systemic autoimmune and hematological diseases, so first, when we're talking about autoimmune diseases are diseases where basically there's an inappropriate immune response that results in inflammation and tissue damage. When we're looking at autoimmune diseases, we're essentially just looking at conditions where basically the immune system just attacks the body. So again, the common autoimmune disorders and ones we're going to be talking about, we're going to be looking at rheumatoid arthritis, lupus, chronic fatigue syndrome, fibromyalgia. When we're looking at hematological disorders, so we one of the big differences between if we're separating the two categories, autoimmune diseases, the etiology behind them is unclear. So there's reasons why we think the immune system produces this response, but overall, the overall etiology for autoimmune disease is unclear. Whereas with the hematologic disorders, we know what the etiology or what the cause actually is. Now, in both cases, talking about both autoimmune and hematological diseases, both stem from a combination of things, genetics, history of infection, environmental factors, endocrine function are all things that can contribute to the conditions that are in each of these categories that we're looking at. In both instances as well, the intervention usually involves minimizing symptomology. In other words, a lot of the medication options and treatment options don't involve cures per se, but they're given in an effort to just basically improve quality of life, help to improve function, and basically minimize symptoms. In the case, for instance, a lot of the autoimmune diseases, one of the things you look at kind of controlling is the inflammatory response that could be happening, which causes further damage to the body. And then just before moving on, so obviously I went through the autoimmune disorders that we'll be looking at, the hematologic disorders, or basically the disorders surrounding the blood that we're going to be looking at in the interventions for. We're going to be looking at HIV and AIDS, sickle cell anemia, and hemophilia. So rheumatoid arthritis is an autoimmune disorder that's going to result in chronic inflammation of the joints, and it's also going to be associated with long-term muscle atrophy, joint deformity, and then eventually you're going to get, over time, because of what goes on with the joints and the muscles, disability and a decline in mobility. It's linked to a number of other conditions that can also be debilitating. So lupus, coronary artery disease, osteoporosis, are other conditions that many times get linked with rheumatoid arthritis. This is the most common autoimmune disease, so it affects at least 1% of the population worldwide, as far as who is, so it is a very common condition that gets encountered. So when we look at how rheumatoid arthritis kind of affects the body, what it essentially does, it usually affects the synovial lining of the joints, and the cartilage in the joints. So basically all of our joints have a joint capsule around them and synovial tissue that kind of surrounds it. So that synovial tissue gets damaged with the rheumatoid arthritis, and the articular cartilage gets damaged as well. Over time, then you start to have impacts to the other body systems. You have, it could spread to the myocardium or the heart muscle. It could spread to the lungs. It could spread to the kidneys, the other tissues. And then basically, when you look at the severity of the rheumatoid arthritis, it's basically going to be based on the number and the size of the affected joints, the presence of rheumatoid antibodies, and the duration of symptoms. As I said, that this is a condition linked to many other conditions, particularly cardiovascular disease. I mentioned some of them on the screen here. There's a couple others it's also commonly associated with. Interstitial lung disease is another one. Sjogren's syndrome, or dry eyes and dry mouth, vasculitis. So there's a lot of other conditions that many times it's associated with. The risk is also higher in women to develop rheumatoid arthritis. Again, there's no cure for this, but the main goal is to primarily control the inflammation, minimize pain, and just really try to allow the person to maintain their mobility and function is going to be really important. Another common classic thing you see with this are these lumps that basically form in the wrists and fingers and hands. Are known as rheumatoid nodules, which are formed essentially from the inflammation that occurs. So as far as the medications, again, we're essentially looking to just reduce and control the inflammation present and kind of minimize the symptoms. Non-steroidal anti-inflammatory drugs can be used. Again, this is many times used for short-term management of pain and inflammation. There's no real known negative effects except for a possible attenuation of the tissue repair process. So it could possibly kind of impair. We all know that when we exercise, our tissues do go through a repair process because of some of the micro trauma and everything that occurs to them. It could possibly have some negative effects on that, but big picture, probably nothing major that would affect exercise. There's disease-modifying anti-rheumatic drugs that inhibit the body's immune response, and there are synthetic versions of them that are used as well that can be utilized to help treat rheumatoid arthritis. The synthetic ones are slow acting, and they're given to minimize the long-term joint damage. Whereas if a glucocorticoid or a corticosteroid gets affected, they only last weeks to months. So, and again, many times, another medication that sometimes will be administered are intra-articular injections of corticosteroids to help control the inflammation within the joints. So again, look at the medications table again to be able to recognize, again, as you're going along, you're going to start to see some medications that you've seen before. Just kind of make note of them as to how they're used to treat this and other conditions. As far as the effects of exercise on individuals with rheumatoid arthritis, again, a lot of the similar effects that you see in healthy individuals. Particularly for individuals with rheumatoid arthritis, it's to help them maintain their functional abilities. Be able to help them maintain their mobility, which can significantly go into decline when you're looking at individuals with rheumatoid arthritis. Resistance training, as we know, there's good research on that in just preventing falls. So that would also carry over, be a benefit to individuals with rheumatoid arthritis. And again, enhance balance, range of motion from resistance training and neuromuscular training. They also say that even things like yoga and Tai Chi work very well in as far as utilizing, different forms of exercise can be beneficial. As far as recommendations, again, exercise, low to no impact, particularly if their rheumatoid classification is high, and just make sure to avoid overuse. So, here you should try to vary the modes as much as you can to just kind of, limit overuse injuries. So you might want to change your exercises more frequently. Those of you that, possibly using a conjugate approach where you're changing your exercises. Again, it doesn't have to be, very frequently, but just to help avoid overuse. Intensity should be low to moderate as far as your aerobic exercise. Preferably every day if they can do some type of low intensity aerobic work would be beneficial. Your resistance training here, good, recommendations in the 10 to 15 rep max range. Again, 2 to 3 days a week, 1 to 2 sets. Avoid ballistic movements. Again, you could look at your percentage in the 40 to 80% of a 1 rep max when you're kind of estimating. Again, look at modifying based on the joints. Flexibility training should be encouraged to help improve pain-free range of motion. But again, just be mindful of the types of techniques that you're using for that so that you don't overstress those particular joints. And then, make sure you're doing a cool down. I mean, a cool down is probably something that many times gets ignored for just even healthy people, even, people without any type of condition should really be doing a cool down. Static stretches are fine for that. Shorten the duration of the holds of the stretches. 5 to 10, as short as 5 to 10 seconds initially, and then progress to maybe like 20 seconds, but you'd want to kind of do a little bit of a shorter hold. Plus also consider things, again, yoga is very good as long as it's, reasonable as far as like the intensity of the yoga, the poses that they're using can certainly be something that would be beneficial as well. Okay, lupus. So lupus is a multi-system autoimmune disease whereby the inflammatory process systematically kind of breaks down body tissues, and it ranges from everywhere from the skin to the internal organs. So when you're classifying the type of lupus that somebody has, very important to distinguish between discoid lupus erythematosus and systemic. Discoid primarily affects the skin, so there's more related to the dermatological system when you're talking discoid lupus, whereas systemic lupus is more broadly affecting the body and can be either organ-threatening or non-organ threatening. Lupus affects more women than men by about a 10-to-1 ratio, and usually the symptoms could appear anywhere between age 15 to 45. And life expectancy and quality of life are greatly affected with this condition. Again, the causes of lupus are largely unknown. There could be genetic, environmental, hormone factors involved. The triggers for it, as far as things, environmental triggers that would cause flare-ups, could be UV radiation. Drugs that produce photosensitivity, like penicillin, other antibiotics, infection, virus, exhaustion, stress, are all things that can be a trigger. A lot of the signs and symptoms that people will experience when they're getting kind of diagnosed with lupus, they know fatigue, sleep disturbances, low levels of physical fitness, depression, cognitive impairment, what they call a malar and discoid rash, photosensitivity or sensitivity to light, oral ulcers, arthritis, kidney issues, neurological, hematologic disorders related to this, anti-nuclear antibodies being present. These are all things that are factors in the development of lupus. So again, this is something that affects a broad range of areas in the body as evidenced by the signs and symptoms we talked about. As far as like a lot of your primary physiologic factors, again, what we tend to see here are, again, a lot of actions obviously related to the immune system. There's cytokine dysregulation and B cell activation that increases the immune system activity that then goes and affects the body, where basically you're getting hyperactive B and T cells present that are going and causing issues in the various systems throughout the body. Again, as far as treatment goes for medications, like rheumatoid arthritis, you're basically just looking to reduce inflammation. Most of these medications they take don't necessarily affect exercise capacity, but they could make exercise uncomfortable. Again, NSAIDs could be, or non-steroidal inflammatory drugs can be given to these individuals. Again, typically no major side effects. Again, they may even mitigate fatigue, but they can inhibit recovery. Part of what I talked about, I talked about that when I was discussing rheumatoid arthritis. NSAIDs have the ability to inhibit prostaglandins. The reason why basically the recovery issue, I didn't explain the recovery issue and why it happens, but The reason why NSAIDs have the potential to kind of inhibit exercise recovery is that they tend to they inhibit prostaglandins. So prostaglandins are a substance that signal a response to the inflammatory, which you will get when you exercise, because obviously your tissues have to heal from exercise. So they signal a translational response to resistance exercise in particular, which that becomes your recovery issue. Anti-malarial drugs, or basically drugs used to treat malaria, are sometimes used to treat lupus as well. Some of the short-term side effects that you have with them are muscle weakness, abdominal discomfort, and loss of appetite. So some other side effects with a lot of common drugs, again, corticosteroids could have longer-term side effects. Corticosteroids can get administered to treat the inflammatory response with lupus. Basically, for anytime you're talking anti-inflammatory drugs, you have NSAIDs and you have corticosteroids. NSAIDs are your non-steroidal anti-inflammatories. Corticosteroids are steroids and are used to treat inflammation. They could possibly have much more longer-term side effects, including weight gain, hypertension, higher blood pressure. There's other types of medications and supplements that are used for lupus. Dihydroepiandrosterone, which is a supplement. It's an unapproved medication that gets used for lupus, but it can be used to enhance muscle mass and strength. However, it has many side effects, possibly acne, facial hair growth, excessive sweating, lowered HDL, and increased estrogen levels in postmenopausal women are things that could be that could have come about with DHEA supplementation. So, if you've never heard of DHEA before, DHEA is it's a steroid precursor. It's produced in the adrenal glands, the gonads, and the brain. So that's something that can be supplemented with. Again, it's not approved necessarily for the treatment, but for some of the issues associated with lupus, it could potentially be of benefit. So looking at the effects of exercise, so research has shown that high-intensity aerobic training is actually pretty well tolerated and improves aerobic function with no further damage in individuals with systemic lupus. Resistance training studies have been done less frequently, but usually show improvements in muscular strength and quality of life. The thing you do have to be aware of, though, is, again, given that stress is something that can be a trigger for symptoms, you just have to watch, because sometimes excessive activity levels can cause excessive pain and fatigue. And again, that's going to be something that is going to kind of be an ongoing theme. Again, as I told all of you, you're going to see things that are common as it relates to exercise. So with a lot of these autoimmune conditions, you really have to be aware of the level of activity. And like I said, some conditions, some individuals will be able to tolerate some higher intensity activity, but you have to remember with that, high intensity for them could be a little different than what it means for the general population or the athletic population. So just keep that in mind when you're talking about that. So again, if you do even go to high intensity, again, they may have to limit their activity over the course of the next couple days. So they may have to have more rest days in between than somebody if again, general pop or an athlete does high intensity activity, they may only need 48 hours, whereas someone with lupus may require 72 or 96 hours of recovery in that instance. So watch for signs and symptoms of poor adaptation. If they have prolonged soreness, fatigue, they start to lack exercise tolerance. And many times, though, this population suffers from comorbidities associated with lack of activity. So we certainly don't want to deter or cause, major exacerbations of symptoms that would, keep these individuals from wanting to partake in the physical activity. So again, your exercise recommendations, again, you can look at table 7.2. Again, individualize according to the symptoms Be conservative in nature at first. We do know that there is the chance that some higher intensity activity can work for these individuals. It's just a matter of, how will they recover from it. Aerobic activities should be performed 3 to 4 times a week, 10 to 12 RPE. 10-minute bouts at first are preferable. So again, you could kind of break it into shorter exercise periods over the course of the day. Again, vary it to avoid overuse injuries. Again, avoid ballistic motions. So make sure you're going through, pretty smooth ranges of motion. The goal should be more days per week. But again, gradual changes. Don't have any sharp increases in, intensity or, only basically increase one variable at a time for these individuals, because that's all their body's going to be able to handle, and wait and see how they adapt to that, because it could be very difficult for these individuals to kind of adapt over time. So resistance training is going to be really important because it can help support and protect the joints in individuals with lupus. So again, 2 to 3 days a week, symptom dependent, light to moderate intensity. Again, 1 to 2 minute rest periods. If they need longer, that's fine. Again, stretching. Many times, just like with the rheumatoid arthritis, you're going to want to start with some shorter duration stretches and then work to gradually increase it. So again, start it with 5 to 10 seconds, gradually start to work your way to 10 to 20 seconds over time. All right, chronic fatigue syndrome is an autoimmune disease characterized by unexplained fatigue lasting more than 6 months, and it's not relieved by bed rest. So chronic fatigue syndrome, the causes of it are unclear, but they basically will diagnose this based off of self-reported symptoms, some that we'll talk about more beyond just the fatigue in a bit, and the exclusion of other possible diagnoses. So this is another one of those conditions that this is a diagnosis based on exclusion. In other words, there's this array of symptoms, and again, fatigue obviously being one of the primary things the person complains about. But through various tests and blood work and everything, there's really no other diagnosis. So chronic fatigue syndrome is where it will typically get the fit. They're not sure, again, as far as physiologically, either what causes it or what some of the issues kind of emanate from. So again, they think that possibly a viral infection that the person had in the past may have caused this. Abnormalities in the hypothalamic pituitary adrenal axis, which would impact hormones, things in the serotonin pathways, or possibly like a neurological mediated hypertension could also be involved with this. It's diagnosed more often in women, and usually it's diagnosed between the ages of 20 and 50. Again, a variety of symptoms are associated with this. So obviously fatigue being the primary one. However, there are other things, sore throat and headache, sleep disturbances, depression, could be found in conjunction with other disorders such as irritable bowel syndrome, which is a motility disorder in the gastrointestinal tract, and fibromyalgia, which we've already talked about. Some also believe this is another version of an anxiety disorder. A lot of the treatments that you look at with this focus on various things. There's pharmacological intervention, which we'll talk about with the medications in a bit, stress management, nutritional supplementation, educational interventions, group therapy, energy conservation, and again, just regular physical activity in the case of managing symptoms. So pharmacological recommendations have been made. There's no scientifically backed treatments for this. Again, it's kind of based on the person's symptoms. So again, common medications include sleep medications, pain relievers, and antidepressants. So if you look at the categories of that, you can kind of see what medications would fall into that. Stimulants have been shown to benefit exercise performance. However, It may decrease the ability of the heart rate to appropriately match the metabolic demand. So this is called chronotropic incompetence, when basically the heart rate and the demands of the exercises aren't met. So what this means is the person actually gets like a decreased peak heart rate. A couple other things that get suggested for individuals with chronic fatigue. Again, the research is kind of iffy on it, but again, for a condition where it's really kind of hard to pinpoint the cause, obviously, and again, like I said, it is primarily a diagnosis of exclusion. There are some things that get tried, various vitamins, minerals, CoQ10 has been suggested. There's even been specific amino acids that have been suggested for use with chronic fatigue. So the effects of exercise, again, something to just kind of note. So obviously, a big part of this, the issue with this condition is fatigue. So due to discomfort and fatigue, exercise intolerance is common, and post-exertional fatigue or malaise can be severe. So again, when things are getting prescribed early on, you really have to watch to make sure that the individual is able to tolerate the physical activity. So, the exercise intolerance could just lead to avoidance behaviors. So, even moderate activity can be difficult for individuals with chronic fatigue. However, some of the benefits, so for instance, resistance training has been shown to improve strength and lead to lower levels of fatigue. However, you just have to really watch the intensity of the exercise. They also, some research has also shown that even things like yoga and other exercise modes can help reduce sleep disturbances in a lot of the symptoms. Light walking, water aerobics is also some things that have been recommended. So again, this may be a situation where you may have to find other suggested activities for the individual, but definitely you still want to make sure that strength training and just general overall metabolic conditioning is getting done, because in the end, it can help them with their day-to-day activities. You just have to really be cautious of the intensity you're using. So along with the other exercise recommendations, some things, again, a symptom-dependent approach is recommended. So again, make sure you're using exercises that are well-known and tolerated for the individual. They should recommend light activity on most days. So again, this could be something that would be better for the person. Again, instead of having really hard workouts and giving days off for recovery, light activities on most or all days. And again, look to improve functional capacity without perpetuating the fatigue cycle. Aerobic exercise should progress first in duration and frequency before increasing intensity. So I think this is an important point, that intensity for these individuals a lot of times is going to be the last thing that you're going to look to raise in your progression. So obviously the progression here is going to take a little bit longer. Again, shorter bouts may be better at and be more effective at preventing excessive fatigue. So they may want to do shorter bouts, even break it up over the course of the day. Again, light activity every day better than, kind of having harder workouts and, then, kind of exacerbating their symptoms in that fashion. So again, symptoms may dictate a reduction in intensity and duration on certain days. So again, be aware, don't overwork them, don't look to bring on extreme post-exertional fatigue. Rest between sessions will be good. Again, if you could just even do light activity, encourage that. Sometimes people think that, in order to, keep up their fitness or whatever, that they need to kind of burn themselves out with hard exercise if they're not feeling up to it. Just some light activity just to kind of get some work in. Dynamic and static stretching performed daily to help maintain mobility. Again, encourage trunk stability exercises as well. And again, the trunk stability exercises in conjunction with the flexibility can help with a lot of the mobility problems as well. Okay, so making sure that you're making sure to kind of do that to encourage stabilization. So again, stable at the torso, mobilize at the joints, specifically the hips and shoulders. And again, for some individuals, and they actually make this point in the text, and I've kind of talked about this even in the classes where we've talked about strength and conditioning, even for athletes who kind of have a low level of just general physical preparedness, is that the warm-up might actually provide all the stimulus at first. So what you would sometimes classify as a warm-up, for someone who's more active and healthy, that may be the workout here for chronic fatigue syndrome. So bear that in mind. Think about maybe, if you're not sure how hard to go with an individual like this, think of what you would do for a typical, dynamic warm-up, even if it involves, again, we've talked about in other classes how you can use strength exercise, strength circuits as a warm-up. And that could be something that could be utilized for these individuals. So with resistance training, and again, resistance training can really make a lot of important, physical improvements for these individuals, as kind of emphasized in some of the research and discussions that's even in the text. But you begin with body weight, add resistance once they could perform 10 to 15 repetitions with proper form without significant fatigue. Again, this would be even more important for an individual who maybe hasn't partaken in a whole lot of resistance training up to that point. And again, avoid volitional fatigue. So it's probably a good idea to leave at least 2 to 3, as they always say, leave 2 to 3 reps in the tank, as they would say, and make sure that they can, do 10 to 15 reps pretty clean before significantly increasing the exercise intensity. So, once they could get 10, 15 reps or, whatever, maybe have them do a weight where they're getting 10 clean reps, they work their way up to 15, then you could kind of go back to 10. Any one of those ways would do it, making sure that they always have, like I say, about 2 to 3 reps to go, so you're never really taking them to complete fatigue. And one set of each exercise, at least initially, will be good. Again, you could start with 1 set, gradually build your way up to 2 to 3 sets as well. So, you may have them do even like just 1 set of every movement. Again, think of the, the movement categories that we've discussed. We've discussed it a little bit in this class, but in some of the other classes, a squat movement, a push movement, an upper body push, an upper body pull, a hinge, and kind of just give, 1 movement each, let them do it, and that's their workout. And, even if it seems easy for them, that's fine. Let them start to add that. They're basically adding additional activity to their day and building up tolerance to their body. So that's really kind of the important thing you're looking at when you're doing this. So fibromyalgia, we had mentioned fibromyalgia being possibly something going on with chronic fatigue syndrome. So it's similar to chronic fatigue. It includes widespread musculoskeletal pain, sensitivity to palpation and fatigue. The sensitivity to palpation and musculoskeletal pain are kind of like a hallmark of this, and are actually part of the diagnosis behind fibromyalgia. Other things these individuals tend to experience is just general muscle stiffness. So they'll just kind of complain about being stiff and achy. They have a lot of non-restorative sleep. In other words, they might sleep, but it's not good sleep. And they don't tend to feel good after sleeping. Headache, sensitivity to light, cognitive impairments. As I said, the diagnosis, so that there's actual diagnostic criteria for this condition. So, and it's based on largely self-reported symptoms. So again, you would look, an individual diagnosing someone with this would look at pains and symptoms experienced within the past week of the exam. And the big thing is they include tenderness at 11 out of 18 anatomical sites. So there's actually 18 anatomical palpation points, and what they look for is tenderness in at least 11 out of those. So if there's tenderness in at least 11 out of 18 of those sites, if they've had symptoms lasting at least 3 months at about the same level, and in conjunction with that, there's no other health problems that could explain the symptoms, so they would still look to rule out other things just to be sure. But, unlike, the chronic fatigue, you at least still have those other diagnostic criteria. But you would still, much like with chronic fatigue, look to rule things out, before someone would get diagnosed with fibromyalgia. Up to 70% of individuals with fibromyalgia do also have chronic fatigue syndrome, so they also do have the criteria to meet that. Again, most of the cases do occur in women, but it is partly dependent on classification criteria. Symptoms tend to be more severe in younger and middle-aged adults compared to older adults. So those are some other kind of classic things you would typically see in individuals with fibromyalgia. So again, there's no known cause of fibromyalgia. There's possible triggers that have been proposed. Again, and some of these are going to sound familiar. They might be triggered by actually an upper body injury, and interestingly enough, a lot of times it's a minor injury that may do it. Viral illness, chronic stressors are also kind of known for this. Physiologically, individuals with fibromyalgia are known to have higher level of something called substance P, which is basically a chemical mediator that regulates pain sensation. So it has been shown that individuals with this do have that increased level of that, which obviously will make them more sensitive to pain. They also sometimes call this central sensitivity syndrome, whereby a person just generally has a lower threshold for responding to both pain and in other types of, typically noxious stimuli. So heat, noise, odors. They also tend to have a lower threshold for that as well. Again, there's no known cure for this. There's various ways to kind of manage the symptoms and some things that have been found to be successful. So again, massage, joint manipulation. So there are some other physical-based rehab options that can be done to help improve this. It's also very common to see people with fibromyalgia to have something what's called celiac disease, which is a gastrointestinal problem related to gluten sensitivity. So that's another common issue to see in individuals that have fibromyalgia. Okay, so looking at medications, again, the goal with a lot of the treatments, your medication table, you could look at that. Again, always refer to the medication tables on the various conditions. Your goal here is basically a couple different things. Look to reduce pain, sleep enhancement, and improvements in mental health, so reducing depression and anxiety. Now, there have been 3 medications, so this is an important point, that have actually been approved specifically for fibromyalgia. So Lyrica, Cymbalta, and Savella. So Lyrica is typically used as a pain reliever. It's licensed as an anti-epileptic, but it's used to treat chronic pain. So it does help with nerve-based pain. Cymbalta and Savella are both antidepressant medications that have been utilized as well. Savella also is known to help with nerve pain, in addition to being an antidepressant. So NSAIDs can be commonly used as well. Again, there's no real ill effects for those. I mean, obviously they're used for pain relief because they could inhibit they do prostaglandin inhibition. However, it could possibly slow recovery from exercise. Antidepressants and muscle relaxants obviously have side effects that make exercise uncomfortable. But sleep aids do not greatly affect performance. The only thing sleep aids can do sometimes is they might make exercise in the morning a little bit more difficult. And that's primarily because one of the issues with sleep aids is that sometimes people could feel a little, groggier in the morning. But they don't have any direct effect on exercise. So exercise is widely used in fibromyalgia management and has been shown to reduce the severity of the symptoms. Now, another thing to note, like a lot of these other conditions, Obesity and being overweight are both common problems or comorbidities that tend to happen in individuals with fibromyalgia. Like chronic fatigue syndrome, your intensity and volume of the exercise has to be, really controlled well to make sure that you're not raising the intensity of exercise too fast for these individuals. So, but for both of those conditions, for both chronic fatigue and for fibromyalgia, you could say that there's a narrow therapeutic window for exercise. So what that basically means is that exercise can be very beneficial, but in a very limited amount. Little too much, and you're going to start to exacerbate symptoms. So really important to kind of note and just really watch your exercise intensity. So again, low impact exercise. Again, one of the things your book suggests, accumulating at least 5,000 steps a day can be an early goal to begin with, particularly a lot of your aerobic exercises. Begin very conservatively with that. So that, the 5,000 steps, 1 to 2, light concerted sessions of aerobic exercise. Again, shorter bouts may be more effective at preventing fatigue, excessive fatigue and improving compliance. So again, look at also including, stretching flexibility has also been something very beneficial. Improved balance can be helpful as well. So, and again, you don't necessarily have to do a ton of balance exercises, but obviously, unilateral strengthening exercises will certainly help with balance. And again, just various exercise modes, stretching, resistance training, alternative activities can be very beneficial. Let clients sort of self-adjust their intensity. That could be something that could be beneficial as well, kind of allow them to kind of moderate their intensity level. I would even say maybe it'd be a good idea, educate them on the rating of perceived exertion, kind of go through that with them and, and tell them, hey, this is where you should feel, if you're, if it feels like it's a little too much, or maybe you just don't feel it's enough, let them kind of regulate that a little bit more. So again, like chronic fatigue, you can start with body weight exercises would probably be good. And again, you could, or if you do start to use external resistance, again, it's a trial and error process, but keep the intensity about 40 to 60%. And resistance training has a lot of benefits as far as, their tolerance to perform activities of daily living. So it should be noted that that's something that would improve with them. Make sure that they, again, always make sure they feel that they could perform additional reps. So, if you're saying, hey, do 10 reps of an exercise, they're probably doing something that they could maybe do 12 or 13 with, and that would be a better way for them to do that. Another interesting point is that individuals with this, again, you could begin with 2 training sessions, or and gradually increase them. Some clients might actually tolerate a 4-day, so almost like an upper body, lower body. So a lot of the conditions we've been talking about, we've been saying, oh, do full body days and everything. Fibromyalgia, because there's that soft tissue component and the tenderness with the muscles, you might find that some people might tolerate 4 days with different muscle groups better. So like a classic upper body, lower body day, or like a push-pull day. And you could do push-pull days, including lower body exercises with that. So if you're doing, say, did like a push and pull, your more quad-based movements go in the push day. Your hamstring posterior chain movements would go in the pull day. So that's an additional thing that you could think about doing as well. Again, passive and slow static stretching should be low intensity. You want to do shorter stretch holds, longer than, we've talked about in the past about static stretching going 30 seconds or longer. For these individuals, that can be very difficult and cause a lot of problems. Start with 10, 15-second stretch holds, gradually increase the stretch holds over time till they can, start to tolerate the flexibility exercises a little bit more. So that takes us into our hematologic disorders. So we looked at a lot of our autoimmune disorders. So now we look at our hematologic disorders. So HIV is a virus that results in gradual destruction of the immune system, known as acquired immunodeficiency syndrome. So the first documented case was in 1981 and has resulted in the death of more than 34 million people worldwide. African Americans make up the largest percentage of new HIV infections, followed by Caucasians, then Hispanics. Interestingly enough, though, in general, new infections have fallen drastically since 2000. There's two different forms of the virus. There's HIV-1 and HIV-2. Both are spread through the exchange of body fluids, including blood, semen, vaginal secretions. Your transmission methods include unprotected sex, needle sharing, blood transfusions, organ transplants. Also, the breastfeeding, a mother could pass it on to the child. When compared to HIV-1, which is the more common form, the HIV-2 immunodeficiency appears to develop more slowly with more mild symptoms and is initially less infectious in the early stages, but becomes more so as the disease progresses. However, HIV-1 is the more common of the two variations of this. So how this affects the body. So HIV attacks what are called CD4 helper T cells, which are an important part of your immune system. And over time, the infected individual just becomes more and more susceptible to infections and other issues, some forms of cancer and kidney disease. So what essentially happens is that the body's just unable to fend off infections or keep, or preventing cancers from forming, and the person basically ends up many times being susceptible to what you would call an opportunistic infection, whereby their body can't fight off the illness, and that ends up causing death. The HIV infection has 3 stages. So in stage 1, the individual can transmit the disease, but they are asymptomatic except for flu-like symptoms. Stage 2, this is when the CD4 cell count starts to get reduced. They start to experience weight loss, muscle wasting, fatigue, weakness, and swollen lymph nodes. And then at stage 3, there's a significant depletion of CD4 cells. So basically, over the course of the infection, the individual will get T cell testing done. There becomes a part in the tracking of it where once their T cells fall below a certain level, that then kind of changes the stage in the disease they're at. And at stage 3, that basically significantly increases their chances of those opportunistic infections and possibly being more susceptible to cancer. And usually that's going to occur over the stage of 2 to 15 years. Now, it's in stage 2 where the individual will start to develop the AIDS-related complex. So it's kind of where the transition occurs from HIV to AIDS in stage 2. So medication-wise, there's still no cure. However, the antiretroviral agents that have been used have improved in quality and has actually improved the quality and length of life much more than in recent decades. So individuals are kind of living with the infection without having major complications for a significantly longer period of time than had been in the past. And again, the common medications, so these should kind of stand out a little bit more because these are a little bit more unique. So you've been seeing a lot of, for instance, pain medications and antidepressants. You've been kind of seeing those over and over again. This is probably a little bit more unique, so kind of make note of this. So these are your antiretroviral agents. Your nucleoside reverse transcriptase inhibitors, non-nucleoside reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, entry inhibitors, integrase inhibitors, and pharmacokinetic enhancers. So just some things to note. with the nucleoside reverse transcriptase inhibitors, there's a risk of myocardial infarction and lactic acidosis with those. They do sometimes impair mitochondrial function. So that would be some things that you'd want to make of note, particularly as it relates to cardiovascular disease. And it also does, they do also in particularly reduce insulin sensitivity, which can make somebody more susceptible to developing type 2 diabetes. So that's an important thing to note. There's also what's called highly active antiretroviral therapy, which directly will reduce the HIV particles in the blood with a resulting increase in CD4 count. However, they have found with these also an increased risk of metabolic and cardiovascular issues. So with this type of treatment, they've noticed, for instance, lipohypertrophy, increased what they call central adiposity, where people start to their fat cells start to increase in size. So some of these medications have particular cardiovascular risks, so you'd have to do that. So many times, like they may prescribe like a statin for these individuals to possibly reduce the risk. So they may be taking a statin on top of the which we've talked about, which we've obviously talked about before, in their ability to reduce blood lipid levels. So if we look at the effects of exercise, so exercise in general has a positive effect on immune function. So long-term survival with HIV infection does become more difficult as the disease progresses. So it's important that exercise should begin as early as possible after the diagnosis. Aerobic exercise does improve fitness and reduces body fat. So if they are taking for instance, if they're doing that highly active antiretroviral therapy, it would be important for them to do aerobic exercise to minimize possibly having cardiovascular side effects from that. So that could definitely improve that. And again, resistance training is another preferred method to help maintain fitness. Part of that because of the muscle wasting issues that occur with the disease. And again, consider also other supplementation that could help with that. So obviously diet, making sure they're getting enough protein to avoid muscle wasting, even going as far as recommending androgen supplementation and possibly growth hormone for these individuals. So as far as the recommendations, again, the immunodeficiency stage will usually determine exercise prescription. Really for individuals in stage 1, which, hopefully this is where they're really starting to kind of really get into improving their fitness. If they had, again, maybe there's somebody who's been physically active in the past, but if they haven't been, this would be the stage they would really want to really start to work on this, because as the disease progresses, their physical capacity is going to become diminished, so they'd want to make sure that they start this as early as possible. Exercise tolerance should be monitored, and again, CDC precautions for transmission should be strictly followed. Again, just general universal precautions, which is really no different than what you would do with anybody else. Again, because, obviously the concern is the body fluids, but, blood or basically any body fluids excluding sweat can possibly transmit HIV. However, the transmission in most settings is very low. Aside from the modes of transition that I talked about at the start of this, with most forms of physical activity, the transmission is really low. Even in sports, basketball, football, baseball, it would be very low. I would say probably your greatest risk would be with combat sports, obviously, which the person would not be partaking in. Anywhere else, the risk would be significantly lowered. Again, the cardiovascular component of this is going to be important because of the cardiovascular issues related to the medications. So the specific medications utilized to treat and manage this, because of the fact there's so many, it does put the person at risk for heart attack and cardiovascular disease. This becomes really important. So here I'm just kind of showing you again similar recommendations to what we've recommended before. So now we're kind of getting back to that, you know, a lot of the conditions we talked about earlier on in the chapter. We had mentioned about fatigue being a problem. Well, now we're kind of getting away from that a little bit. So we're getting back to our general recommendations. Resistance training to prevent muscle wasting. This is going to be very important. Plus, just again, developing lean tissue is healthy for anybody. There's not a whole lot of specific guidelines. Again, you can go with that 60 to 80%, or you can go lighter with higher repetitions. You know, so the 60 to 80%, you're usually looking at 8 to 12 repetitions, but you can certainly go to higher rep ranges. 15 to 25 would be fine as well. Again, high intensity exercise is shown to be safe and effective. Moderate intensity is only recommended, particularly if you're dealing with somebody who, you know, maybe hasn't done strength training in the past. Light intensity exercise is also acceptable. Again, add more sets and add more volume as tolerated by the individual. Okay, sickle cell disease. So sickle cell disease is a genetic disease that results from a mutation in hemoglobin, which changes the shape of the red blood cell, making it more susceptible to damage within the normal blood circulation. So basically, the change in the red blood cell could cause basically like a clumping in the circulation, which could obviously create, you know, issues as far as the circulation's concerned. So sickle cell disease is kind of a group of inherited disorders. The most common and most severe, which is what we're kind of be referencing throughout here, is what we would call sickle cell anemia, which is the most severe version of the disease, whereby the person who has this basically inherited two genes that cause the sickling. Okay, so this is a recessive gene disease whereby you have to inherit two recessive genes in order to have sickle cell anemia. Sickle cell trait is something else that an individual can have. In sickle cell trait, you only have one mutated gene. So an individual with sickle cell trait could have sickling occurring, but it's not a constant ongoing thing. So it's a less severe form of sickle cell disease, but the person could still end up having issues because of it. This is a disease more common in individuals of African descent, and it's least common in Caucasians. Due to the risk of cardiovascular complications, NCAA actually requires sickle cell testing on all athletes. So all athletes will have to have, an NCAA requires sickle cell testing. And here, so the deoxygenated blood cells take on an elongated, fragile shape, which again inhibits blood flow. This is what I was getting at earlier, and make blood cell damage loss much more likely, in particular during exercise. The individuals with sickle cell trait have less of a chance. However, they can suffer from what's called exertional sickling, whereby if they're in an activity, particularly very high intense activities, individuals with sickle cell trait could have exertional sickling and then could have the same issues related to the sickling as someone that has sickle cell anemia. So during a crisis with this, again, decreased blood flow, the individual will experience pain, vascular occlusion, arterial and venous thromboembolism, which could result in organ damage. And this typically results in a shorter lifespan for these individuals. Life expectancy for somebody with sickle cell disease is about 40 to 60 years of age. Now that's improved a lot. I believe your book talks about how in the early 70s it was only about 14 years. So it's improved a lot, because of obviously healthcare improvements and understanding the disease a little bit more. The anemia that they experience kind of can range from mild to severe, again, depending on the individual, could affect various organs and systems in the body. And again, in addition to organ and tissue damage, the individual can also experience low cognitive function, shortened attention span, and sleep disorders. And that's because of the low oxygenation level. So again, if the hemoglobin is in that sickle shape, it's not going to be carrying oxygen, thereby the oxygenation levels is going to impact the nervous system, which would cause some of these symptoms that we're describing here. So the medications you would see with this, again, pain medications, again, a lot of this is going to be based upon the person's symptoms and presentations. You have your pain medications you've seen before. Hydroxyurea and sometimes even morphine might be prescribed depending on the level of pain they're dealing with. Blood thinners and antiplatelet medications are common, again, to prevent clot formation. Now, some of the medications can result in side effects, nausea, vomiting, constipation. Because these individuals might have splenic dysfunction because of the issues related to circulation and with the sickling that would occur, penicillin will sometimes be prescribed on a preventative basis just to prevent infection. So penicillin's an antibiotic. It would prevent bacterial infections. Blood transfusion and stem cell transplantation can also be used. Hematopoietic stem cell transplantation is really the only cure for sickle cell disease. So beyond that, pretty much everything else described would be strictly based to reduce kind of like the symptoms. And, you know, in the case of, like, for instance, the penicillin, the possibly being more at risk for infection because of the issues related to the spleen. Now, as far as the effects of exercise, so individuals that have sickle cell anemia are going to have significantly lowered thresholds. They're going to have less exercise capacity, significantly lowered VO2 max. Their anaerobic threshold is going to really be much lower than the average individual. There's also the increased risk of lung and cardiac dysfunction. And this also includes impaired heart rate recovery due to impaired vagal function. So in other words, their vagal tone is dysfunctional. That's going to limit their heart rate recovery. Another big concern is exertional sickling and something called rhabdomyolysis. So rhabdomyolysis is a catabolic destruction of muscle tissue. This is something very commonly seen in individuals that actually have sickle cell trait. So individuals with sickle cell trait, they participate in very vigorous activities. They go into, they do get sickling in their cells, and then that causes the exertional rhabdomyolysis. So that's a major health hazard that is a major concern. Now, interestingly enough, moderate exercise has been shown to be safe for individuals with sickle cell disease. However, very little is known about the amount or intensity that's safe. So when we're looking at the exercise recommendations, particularly those with sickle cell anemia, so individuals with sickle cell trait aren't going to have as many restrictions because they're not sickling all of it. They don't have the sickling occurring all the time. Again, seek medical clearance before beginning any program. Because of the lack of research and no specific exercise recommendations have been given, keep the general duration of exercise to 20 minutes. Now, some studies have been published. If you've done your reading like you should have done, you should note that some studies have been done. Strength and aerobic exercise in children less than 30 minutes has shown improvements for them as far as pain relief goes in the body. There's another study showing the positive effects on aerobic exercise and stretching for 45 minutes twice a week. So, but in general, the overall recommendation is at least start with limiting it to 20 minutes. Keep the exercise intensity low. And again, that's going to avoid any type of circulation issues or anything related to having a sickle cell crisis. Prescription should be based on individual's response to each exercise challenge. If an individual does have an enlarged spleen, they should avoid contact sports. So that would be something, and that, an enlarged spleen, regardless the cause, they would be limited from contact sports anyway. So really, this is a situation where you'd have to be much more cautious at first, really be in good communication and have clear communication with the medical professional treating them to be sure that they're able to, again, having an awareness of the medications they're on would be helpful as well. So just really make sure to modify this. But again, there have been, even though there's no specific guidelines per se in the research, there have been benefits to some low to moderate intensity exercise and training, which can certainly be a benefit to the individuals with sickle cell. Another thing I would recommend, so on page 246 in your textbook, they give the training recommendations for clients with sickle cell disease. Many of the things we've already talked about, particularly as it relates to training intensity, have been included. Some other things that they also include is making sure the individual is well hydrated, because dehydration can create problems. Even in an individual with sickle cell trait, that can be another cause of exertional sickling. And also use caution in extreme weather conditions, both heat and cold. Be careful with that with these individuals. So hemophilia is an inherited blood disorder that results in a lack of blood clotting factors. And again, the severity can range from mild, or just resulting in slower clotting, to severe, where basically anytime someone would be bleeding, they would require medical intervention. So, and basically the way it gets categorized is based on the percentage of clotting factors. So they look at 1% of circulating factors, they'd be classified as severe. 2 to 5 would be moderate, and anywhere from 6 to 40%, they'd be considered mild. Most individuals deficient in clotting factor 8 or suffer from what's called hemophilia A. The most mild form of hemophilia is what's called hemophilia C. So this is also going to be something that's going to be identified in infancy. Again, it's another recessive X chromosome disorder. Males with one parent carrying the trait will inherit the disease, whereas females would have to have both parents with the trait in order to have hemophilia. Comorbidities associated with this include liver disease, HIV infection, joint arthritis, and bleeding are quite common with this. Joint arthritis would be something that would be a concern, particularly as it relates to the exercise prescription. So, one of the things that individuals experience from a musculoskeletal standpoint is that, some individuals experience spontaneous joint bleeding, and that joint bleeding will eventually progress to, early synovitis or inflammation of the synovial capsule, and then to possible joint damage. So that's something that you certainly need to be concerned about in individuals with hemophilia. So looking at the medications, another thing just to note about individuals with hemophilia, again, like a lot of things, the treatments have kind of evolved. So life expectancy has improved significantly. So much like what we talked about with sickle cell disease, hemophilia, the same thing has been experienced. Life expectancy has increased significantly. And when we look at the medications and the treatment for hemophilia, we really look at two different things. We look at, treatment being on an as-needed basis, depending upon if there's a problem, or what we'd call regular treatment or a prophylaxis, whereby it'd be more done on a preventative need. So what you look at here, now this is going to be a little different than what we've talked about before, because here we have, again, specific medications used to dealing with, because essentially what you're looking to do is replace the missing clotting factor. So replacing the missing clotting factor by injecting it is the most preferred. Again, it can be done on demand or on a preventative basis. Again, you may hear the term prophylaxis. That's a preventative basis. So someone may go and get a prophylactic treatment to prevent issues related to the missing clotting factor. Another thing very commonly used by individuals is something called desmopressin. That's a hormone that releases clotting factor 8, and that could be also used to treat even a mild hemophilia for somebody. Antifibrinotic factors can be administered as well, and what that does is that delays the breakdown of blood clots. So even in healthy individuals, eventually blood clots break down, but in individuals with hemophilia, because they're missing clotting factors, clots, even if they can form, will break down much faster. These could be administered in order to do that. None of the medications that are listed interfere with exercise, but some can have some side effects that could possibly make exercise unpleasant or uncomfortable for these individuals. So if you were to go to look at some of the most common side effects, like a lot of headache, nausea, upset stomachs, stomach pain being probably kind of one of the more common ones. Some of them do create, particularly the antifibrinotic agents, can cause issues with breathing, particularly with exertion. So those are some things that to make note as you kind of go and look at some of those other side effects related to the hemophilia medications. As far as the effects of exercise, again, exercise avoidance is common, but in general, there's positive effects to exercise, as there would be with anybody. So again, to avoid issues related to obesity from being inactive, certainly encouraging these individuals to exercise would be good. Resistance training results in improved strength, but there's also it results actually in a decrease in incidence of bleeding episodes, with the greatest improvements in those with the most severe joint damage. So again, there's direct benefits there to for individuals to avoid some of that structural damage that could possibly occur. Moderate intensity aerobic exercise can actually improve clotting factor levels in individuals with mild to moderate, and there's flexibility training has also been shown to have significant benefits in individuals with this. Again, and that's just because of the improved range of motion that would occur, that would be beneficial. So again, we do see some particular benefits that can be seen in individuals with hemophilia, and some of the issues that they would be having otherwise. So here you look at your exercise recommendations. Again, you can look at 50 to 70% max heart rate. Again, start with 15 to 20-minute sessions. Resistance training. Again, all sorts of resistance training can be well tolerated. Again, just kind of start the person where they're at, keep it at moderate intensity, at first maybe avoid that volitional fatigue. So kind of, again, leaving, having the sets stop short of failure would be beneficial. And you have your suggested rest periods as well. I would also include with that, if they already do have some joint pain and joint issues, again, you may have to use some alternative exercises, or maybe limit the range of motion when you're doing that. So be mindful of that as well. They also recommend that sometimes using fewer multi-joint exercises with these individuals might be suggested, at the very least to start. Kind of more isolated muscle group approaches might be better with this. Again, you could start again with body weight exercises, resistance bands. If you're using external resistance, the book recommends 40 to 70%, and the 10 to 20 rep range would be good. Again, increases in intensity should kind of be based upon how they're feeling post-exercise, so be mindful of that. And again, standard prescription should also include fall prevention exercises. which, I mean, in reality, when you look at, obviously we know that strength training can help prevent falls. So just strength training in general improves balance over time. So that's something to note, but have that kind of in the back of your mind, because obviously, people with hemophilia, if they fall, it's very easy for them again to have damage occur to their body. If they, what would be a normal just bruise for somebody who doesn't have hemophilia, turns into a possible issue for somebody missing or deficient in a clotting factor. So that's something to be mindful of as well. Another thing is include some flexibility training, some low amplitude stretches held for 30 seconds at first, progress to 60 seconds again. That over time, and as they tolerate it, they can kind of include that as well. The book also suggests including aquatic exercise for aerobic activity. That would be another thing that you could include as well. There's obviously little risk of falling, and they have the support of the water, so that can actually make the aerobic exercise a little more pleasant, increase their ability to kind of carry that out as well. So again, the big thing is with the resistance training, and I would say even for the aerobic training, just be aware of the joint issues that are associated with, but the resistance training can prevent a lot of that joint damage that could occur versus if they're sedentary. So, and these are your learning outcomes. So again, we have our immunological, hematological disorders. Again, make sure you differentiate which, again, step one is, again, just knowing the conditions that we talked about. So start at that point. So, for instance, after having read the book, after having, gone through this lecture, at the very least, you should be able to start with that. Then you can kind of get into your, the actual pathologies of each one of them. So again, explain the short-term, long-term effects of the diseases, the pathophysiology. Again, make sure to look at all your different medications. Again, some of the medications are things we've talked about. Some of the conditions like HIV and AIDS, hemophilia, they have specific medications that are used in the treatment of those conditions. So again, be able to identify that. Again, benefits and contraindications of exercise and the diseases. So again, you may want to make a separate list. What are the benefits? A lot of the benefits are very similar. If there's any benefits that kind of stand out for a specific condition, that would be important to know. And again, you should be able to develop a program based on the recommendations given.